Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the circle of Willis. The circle of Willis is a large arterial anastomosis at the base of the brain in the subarachnoid space in the deep interpeduncular cistern between the internal carotid artery and the vertebro-basilar system of arteries. So, circle of Willis is a arterial anastomosis. It is also called circulus arteriosus. Okay, between the internal carotid artery, internal carotid artery, and the vertebro-basilar arterial system. So this is the internal carotid artery, internal carotid artery. This is the basilar artery. These are the vertebral arteries. This is one of the vertebral arteries. This is another vertebral artery. They unite to form the basilar artery in the basilar fossa on the anterior aspect of the pons, and this structure is located on the base of the brain, and this structure covers the location of this structure. You have to know that location of the circle of Willis, where it is located. Location, base of the brain, in the subarachnoid space, the space between the pia mater and the arachnoid mater, in the deep interpeduncular cistern. We got the location. This is the circle of Willis here. Okay, it is in the base of the brain, and it is formed by the internal carotid artery, basilar artery, that is formed by the vertebral artery. Okay, we got the formation of circle of Willis. Then what is the purpose of circle of Willis? Why we have circle of Willis? There is an anastomosis between two arterial systems, internal carotid artery, vertebro-basilar artery. So idea is that if anything is blocked here, then there will be compensation from the other side. Okay, so that is the idea. So what are the part of circle of Willis? We have to find out the components of circle of Willis. We have we have the internal carotid artery, internal carotid artery, and it has two branches. One is the middle cerebral artery. This is the middle cerebral artery. This is another one, middle cerebral artery. This one, anterior cerebral artery, anterior cerebral artery. We have another anterior cerebral artery here. So we got another anterior cerebral artery, and we have the anterior communicating artery. One anterior communicating artery. This is the anterior communicating artery. Communicating artery. So we got internal carotid artery, and it has two branches. One is the middle cerebral artery. Another branch is the anterior cerebral artery. Okay, we have the anterior communicating artery, anterior communicating artery. Okay, we got anterior communicating artery. Then we'll get the posterior communicating artery, posterior communicating artery, posterior communicating artery communicate the internal carotid artery to the posterior cerebral artery. So we have posterior cerebral artery, okay. So this is the posterior communicating artery, okay, posterior communicating artery. These are the posterior cerebral artery, posterior cerebral artery, okay. And one vertebral artery, another vertebral artery. This is the basilar artery, posterior cerebral artery. We get also the superior cerebellar artery, a lot of pontine branches, the anterior inferior cerebellar artery. We have the labyrinthine artery, get multiple other branches. These are circle. Okay. So we got again anterior cerebral artery. It is from here, anterior cerebral artery. This is still the anterior cerebral artery. Anterior cerebral artery. Okay. From here, anterior cerebral artery, here cerebral artery, anterior cerebral artery, anterior communicating artery. This is middle cerebral artery. From here, middle cerebral artery. This is the internal carotid artery. Internal carotid artery. Internal carotid artery has two branches. One is the anterior cerebral artery, and the middle cerebral artery. We have another branch that communicate the posterior cerebral artery to the posterior cerebral artery to the internal carotid artery. So this is the posterior communicating artery connecting the internal carotid artery to posterior cerebral artery. Posterior cerebral artery are the branches of the basilar artery. Okay, we meant that basilar artery. So we got the circle of Willis. This is the circle of Willis, also called sulcus arteriosus, at the base of the brain. We got the formation. Now to find out, we have some cortical branches and perforating branches from the circle of Willis. We have to go through those branches again. We have the cortical branches, like what? Like the anterior cerebral artery, middle cerebral artery, posterior cerebral artery. Okay, like the anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. We'll discuss this in our second video. And we have cortical branches. We have also some ganglionic or perforating, okay, ganglionic or perforating or central branches. Okay, so we'll go through that part. So we have ganglionic, perforating, and central branches. Where are those? These are small branches. They go inside the brain substance and supply multiple structure. Like anteromedial group, we have the anteromedial group, a lot of small ganglionic or perforating branches. This will supply the optic chiasm. So the anteromedial group of the perforating branches, you can call it perforating branches. They will supply the optic chiasm, supply part of the hypothalamus here. Okay, optic chiasm, part of hypothalamus. We have the anterolateral group of perforating branches. They will go through the anterior perforating substance. Okay, this will include the lenticulostriate branches. So anterolateral group, that includes the lenticulostriate branches. Those will supply the basal ganglia like the corpus striatum, lenticulate nucleus, caudate nucleus. This will supply those part. We have the posteromedial group. We have posteromedial group here. This will supply the crus cerebri and hypothalamus, part of thalamus. We have the posterolateral branches that will supply the midbrain, also part of thalamus. So depends on where are the perforating branches. This has no anastomosis. They will go inside the brain substance, and if they are damaged, there is no collateral or compensation. Okay, we got the perforating branches. Now we learn some clinical anatomy or applied anatomy. Okay, so two important points. One is that the circle of Willis is made to compensate any block to other side, but it doesn't always happen because posterior communicating artery is usually narrow, so it is not sufficient to maintain the anastomosis if in case of emergency. Okay, so there may be some absence of posterior communicating artery, absence, we may say the posterior communicating artery may be absent. It may be absent. If it is not absent, it may be very much narrow and attenuated. That is a possibility. One. We might have another problem that may happen, that is called aneurysm. What is aneurysm? Aneurysm is the abnormal dilatation of the blood vessel. So where it happens, at the junction will get aneurysm. Any part there may be aneurysm. Okay, maybe also in the middle cerebral artery there may be aneurysm. Aneurysm at the bifurcation of the basilar artery, we may have berry aneurysm. We call it berry aneurysm. It looks like a berry. Okay. Okay, so we may have aneurysm here, may have aneurysm here. So what will happen in case of hypertension or any type of increased intracranial pressure? Okay, so it may be damaged. If it is not damaged, still there is problem of, or the possibility of some problem, because there is aneurysm here, then it will involve the oculomotor nerve palsy. We know that oculomotor nerve supplies the intrinsic muscle, sphincter pupillae. It innervates of the eye. It innervates the intrinsic muscles of the eye called sphincter pupillae. It also innervates the extraocular muscles like the inferior oblique, medial rectus. Okay, so the levator palpebrae superioris muscle. Okay, the inferior oblique muscle. So multiple extraocular muscles are innervated by the oculomotor nerve. Also the intrinsic muscle like the sphincter pupillae innervated by the oculomotor nerve. So any aneurysm, it may damage the nerve, the third cranial nerve. Or if I have an aneurysm here, big aneurysm here, it may damage the optic chiasm. There may be blindness due to compression on the optic chiasm. There may be partial blindness is possible. Okay, and another important point is very important to us, that is rupture of aneurysm. Rupture of aneurysm, especially this type of aneurysm. Aneurysm, what will happen? There will be subarachnoid hemorrhage that will lead to subarachnoid hemorrhage. Rupture of aneurysm will lead to subarachnoid hemorrhage, because we already know that the circle of Willis is in the subarachnoid space, in the deep interpeduncular cister. So if it is broken, there will be subarachnoid hemorrhage. Okay, that will lead to a person the worst headache in his lifetime. It will be worst headache. May or may not be usual presentation. Worst headache in the lifetime. Okay. Plus there will be neck rigidity. Neck rigidity. Okay, so this may happen due to rupture of the aneurysm, especially in case intracranial pressure due to aneurysm. It may be a part of genetic disease, or polycystic kidney disease or polycystic lung disease. It may be a part of that, or it may be an isolated entity, may be a complication of hypertension. So we may have subarachnoid hemorrhage and worst headache in the lifetime of a person who had rupture of the aneurysm, and there may be neck rigidity, and outcome is usually very bad. And that's all about the circle of Willis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.